Welcome to the Dale and Frances Hughes Cancer Center. Our mission is to provide the most technologically advanced cancer treatment in order to offer every patient the optimal chance for cure. We provide a full line of cancer treatment services to our patients. Patients of the Hughes Cancer Center can be assured that they will receive the best possible treatments delivered with the latest technology surrounded by a caring, compassionate staff. All of our physicians are board certified and specially trained in their fields of oncology expertise. Attention will be given to the medical, emotional, financial, nutritional, and psychological needs of each patient and their family. Radiation Oncology. What is radiation therapy? Radiation therapy is one of the most common forms of cancer treatment. Radiation therapy uses a stream of high-energy particles such as X-rays, electrons, or photons to destroy or damage the cancer cells. How does radiation therapy work? All cells, cancerous and healthy, grow and divide. Radiation therapy affects only the tumor and the surrounding area. Once cancer cells receive radiation, they are unable to grow or reproduce. Who is involved in your radiation treatments? During your radiation treatments, a team of medical professionals will care for you, including radiation oncologist, doctors specially trained to treat cancer patients with radiation, medical physicist, ensures the radiation equipment is working properly, dosimetrist, designs the treatment plan in correlation with the radiation oncologist, radiation therapist, positions you for your treatment and operates the radiation equipment, radiation therapy nurse, provides you with information about radiation treatment and side effects. Other supporting staff include dietitians, physical therapists, social workers, speech pathologists, and nurse navigators. How does your doctor plan your treatment? Choosing the type of radiation depends on the type of cancer you have and how deeply the radiation needs to penetrate the body. After a physical examination and a review of your medical history and test results, your doctor will design a plan of treatment. You should discuss with your doctor the potential benefits and side effects associated with your type of treatment. What is a simulation? The simulation process is where your treatment planning will begin. During the simulation, special placement devices are custom-made to aid in your daily treatments. The treatment area will be marked permanently with a tattoo the size of a freckle. What is external radiation? External radiation requires a machine called a linear accelerator. Linear accelerators direct high-energy rays to the cancer site. Treatments are given as an outpatient service but can continue if a patient is admitted to the hospital. Will the external radiation therapy make me radioactive? External beam radiation will not make a patient physically radioactive. When the beam turns off, the radiation stops. Patients can resume normal activities after daily radiation therapy treatment with no restrictions. Patients are able to be around family members of all ages after treatment. What are three-dimensional or 3D conformal radiation treatments? 3D conformal treatments are a technique where the beams of radiation used in treatment are shaped to match the tumor. 3D images of your body are used to create your treatment plan. This type of treatment controls the amount of radiation the surrounding healthy tissues receive. What is intensity modulated radiation therapy, or IMRT? IMRT allows very precise external beam radiotherapy treatments. Benefits of IMRT include reduction or elimination of the extra radiation that would hit outside of the treatment site. Retreat cancers which have previously been treated. Treat multiple tumors at the same time. What is stereotactic body radiation therapy, or SBRT? SBRT treatment gives a very high dose of radiation to a very small area of the body. SBRT is used for early-stage small tumors. Treatments are typically completed in 1 to 5 days. What is brachytherapy? Brachytherapy is internal radiation that uses a radioactive source in the form of a pellet. The implant or pellet is placed directly into or near a tumor. Implants may be permanent or temporary. Will brachytherapy make me radioactive? Low levels of radiation can be emitted for a period of time. Your radiation oncologist or nurse will advise you if any precautions with family members are necessary. How long does the treatment take? Radiation therapy is given Monday through Friday, usually every day. Treatment regimens typically take 1 to 8 weeks to complete. Sessions can last 15 to 20 minutes due to the time required to set up equipment and position the patient correctly. The actual treatment takes only a few minutes. Are radiation therapy treatments painful? A radiation treatment is just like having an X-ray. You cannot see, feel, or taste a radiation treatment. Radiation therapy only affects the area of the body being treated. Preventing and managing radiation side effects. The most common side effect patients experience is fatigue. Your doctor or nurse will give you advice for caring for yourself that is specific to your treatment. Will I lose my hair from radiation? Radiation only affects the area of the body being treated. Radiation treatments to the brain or scalp may result in temporary hair loss. Will I become sterile? Some treatments for specific cancer locations may cause sterility or issues with intimacy in patients. Your treatments will be planned in such a way to avoid these issues. Other options are available for protecting or saving your reproductive options. Please speak with your provider if you have concerns regarding this. What can I do to take care of myself during therapy? Get plenty of rest. Eat a balanced and nutritious diet. Protect the treatment area from the sun. Be gentle to the skin on the treatment area. Avoid wearing tight clothes. Do not rub, scrub, or use adhesive tape. Do not apply heat or cold to the treated area. Do not use a pre-shave, aftershave lotion, or hair removal products on the treatment area. What about daily routine or activity? Some patients find that they need more rest than usual and cannot remain as active. Most patients are able to work and maintain their daily routines during radiation therapy. Support services. Cancer survivorship. Cancer survivorship is the process of living with, through, and beyond cancer. It starts upon diagnosis and continues after the completion of treatment. Personalized survivorship care plans are created for each patient. The nurse practitioner will review this plan with the patient at the end of treatment. What is a survivorship care plan? A survivorship care plan includes the following: a personalized treatment summary including listing of patient care team, relevant pathology results, surgical history, medical therapy treatments including chemo, hormone, and biotherapy, radiation therapy treatments, schedule for follow-up care and continued visits with your oncology providers, information on possible late and long-term side effects and signs of recurrence, available supportive care resources, recommendations for healthy living. Clinical trials. Clinical trials are studies that test and evaluate new methods to diagnose, treat, and prevent cancer. Many cancer patients participate in clinical trials because they offer new alternatives to standard treatments. The Hughes Cancer Center is affiliated with the esteemed Jefferson Cancer Network, offering access to many clinical trials that would otherwise be unavailable. For more information about the clinical trials available at the Hughes Cancer Center, contact our Oncology Clinical Research Coordinator. Nurse navigation. Our nurse navigators are specially trained to help patients and their loved ones navigate the healthcare system. No-cost patient services include expediting patient appointments, testing, and results, providing single point of contact for questions and concerns, anticipating and addressing obstacles efficiently, coordinating with providers for timely diagnosis and treatment, connecting patients with resources, screenings, support, and education. Complementary alternative medicine. Volunteers offer patients physical, mental, and spiritual healing aid through the following programs: massage, Reiki, pet therapy, art therapy, music therapy, guided imagery. Oncology nutrition therapy. Good nutrition is important to maintain before, during, and after cancer care. A registered dietitian is available to support patients during the course of treatment. For more information about nutrition services, please contact the clinical dietitians at the Hughes Cancer Center. Speech-language pathology therapy. Some types of cancer can affect a patient's ability to speak or swallow. Speech therapy can be beneficial for these cancers during treatment. A speech therapist will provide advanced diagnostic and therapeutic interventions for reduced mouth opening or trismus, difficulty swallowing or dysphagia, oral motor and speech or voice dysfunctions, trouble with words or thinking, aphasia and cognition. Social and supportive services. Social workers are available to help patients who are experiencing need for emotional support or financial and transportation assistance. There are several support groups available for patients, family members, or caregivers dealing with the cancer diagnosis. For more information on where you can get help in dealing with your diagnosis, speak with your nurse or social worker at the Hughes Cancer Center. Cancer awareness events and celebrations. Many events take place throughout the year to raise awareness of cancer and to celebrate life. If you are interested in attending any of these events, please visit PoconoMedicalCenter.org. You will be provided with compassionate treatment and hope to give you the care you need most. Let us focus on your diagnostics, your treatment, and your medical care. You focus on healing.